Good morning, good morning, good morning, everyone. Thank you for coming to this web presentation in regards to the Fellows of the National Association of Nurse Practitioners and Women's Health Program, or the FNPWH. My name is Dr. Nalo Hamilton, and I would like to thank you for taking your time with us today as we go over this exciting opportunity. Next slide, please. So for our review and selection committee, we have those of us here are present. We have Dr. Christy Blanco, Dr. Kristen Heckel, myself, Dr. Shawana Moore, and Dr. Jacqueline Piasta. These are the folks that have come in from the inaugural the inaugural class cohort that will be reviewing and looking at the applications. And so we're happy to be here today. Next slide, please. Just a little bit about the FNPWH program. We have a chair and a chair-elect. Our chair is Shayla Lawson, and we also have a Tanya Waters as well. Those are our chair and our chair-elect. They are responsible for making sure that the FNPWH program honors certified women's health nurse practitioners who have demonstrated exceptional contribution in women's and gender-related healthcare, positively impacting patient outcomes while embodying the mission and the vision of NPWH. Next slide, please. So what is the FNPWH program and why is it important? It is important because it provides a dynamic forum for women's health nurse practitioners to share knowledge, to engage, to celebrate best practices, to collaborate, and to help spearhead initiatives to advance the WH&P profession. It's very important at this time that we create a platform that fosters professional growth, leadership, mutual respect. And so we as fellows work to enhance women's and gender-related health and well-being. Next slide, please. Now, for the big thing that everyone is here for today, we want to talk about the NPWH fellows. What is important about these fellows as compared to others in other organizations? NPWH fellows exemplify the highest standards of profession and steadfast commitment to improving healthcare outcomes in these particular areas. It doesn't have to be all of them, but it's important to focus on many of them. So clinical practice, we have those who are leadership, education, research, advocacy, community service, or innovation. Anyone who applies should look at the areas in which their work most exemplifies the highest standards of profession and steadfast commitment. I will now hand it off to my next presenter. Next slide, please.
Thanks, Dr. Hamilton. Thanks for kicking us off. I'm Dr. Jackie Piasta. I'm excited to talk to you guys about the eligibility requirements for all applicants to the Fellows Program. You must be a certified women's health nurse practitioner, WHNP. You must also be an NPWH member in good standing with a minimum of 3 consecutive years of full membership in order to apply. Student membership will not count towards the 3 years of consecutive membership. So if you're a student, this would mean that once you are no longer a student, you have active full membership, then that would start your clock in terms of your standing towards the application. And then applicants also should be current sitting members of the board at NPWH are not eligible to apply for fellowship. Next slide, please, Katie. All right, applications must be submitted by 11:59 p.m. Eastern on March 15th, 2026. So that date will be here before we know it. So March the 15th, 2026. The application is going to need to be submitted through the online platform through NPWH, and it will consist of 4 components. You'll have 2 exemplars for your most significant contributions impacting women's and gender-related health. So refer back to those areas of excellence that Dr. Hamilton highlighted in the previous slide. Also, a summary of contributions and potential for contributing to NPWH's mission and vision. We'll need a copy of your resume and CV submitted in the required template and in the required length as well. And then 2 sponsor recommendations to support your application. Just important to note that members of the review and selection committee may not sponsor applicants for 2 years after their tenure on the committee concludes, and this also includes members of the inaugural FNPWH Development Task Force. Next slide. All right, and last but not least, when you submit your application, you will be asked to respond to the following 3 prompts. The first is summarize your 2 most significant contributions impacting women's and gender-related health, describe your specific role in achieving the impact, provide outcome measurement data to support the scope of the impact for each of these contributions. The second prompt is to describe how your significant contributions advance the mission and vision of NPWH. And lastly, NPWH fellows should exemplify a sustained commitment to NPWH mission and vision. Describe your potential to do this. All right, passing it along to the next presenter.
Hello, I am Kristen Hackle. I was introduced as doctor, but I just want to call out, I have not earned my doctorate. So I want to make sure that you know, not misrepresent myself, but also you can still do great and big things and not have that before your name. So just in case you were concerned, that is not required as part of the application process. But regarding sponsors, and I am happy to speak on this because I think this was a challenging part. So I am going off the screen a little bit for this, asking somebody to represent you, speak up for you, and write this for you. I know can be a challenge, but please know typically people that you have worked with and have supported you will be quite happy to do this. However, there's some conditions that apply. So applications require support of 2 sponsors who can provide information to amplify and support your applicant, your most significant contributions impacting women's and gender-related health. They need to be able to describe how your significant contributions advance the mission and vision of NPWH and describe your potential to exemplify sustained commitment to the NPWH mission and vision. Next slide, please. Requirements for to be a sponsor. They must have a current NPWH membership. I also know that this sometimes can be a challenge. You may work with people, I work with a lot of non-women's health practitioners. So this sometimes is a challenge to find these people. They can join. I had people who up there who had to renew their membership, somebody to be a sponsor. So that is definitely something that can be done to be a sponsor and be current. And one of the sponsors must be a WHNP. So make sure that you reach out and find that person that you are currently working with or previously to be able to sponsor you. And as previously mentioned, that members of the FNPWH Development Task Force are not eligible to be sponsors. Current NPWH Board of Directors members are not eligible to be sponsors, and members of the FNPWH Review and Selection Committee are not eligible as sponsors unless their tenure in the committee has concluded 2 or more years ago. Next slide. I think I'm handing this off. Nope, this is still me. So the link to the sponsor recommendation forms is below, and this will be disseminated as well, provided to applicants during the application submission. Applicants will provide their sponsors when you find someone you'd like to ask to be your sponsor with the form link. Applicants will provide sponsors' names and contact information during their application process. You will include that as part of your application. As a courtesy, NPWH will allow applicants to check if their sponsors have submitted the recommendations by contacting the fellows at npwh.org email. And deadline for sponsors is 11:59 p.m. Eastern Time on March 15th, 2026. It is an applicant's responsibility to ensure the completed recommendation is submitted by the deadline on March 15th by the end of the day. Next slide, please. I think I'm handing this part up.
Okay, that would be me. I will talk a little bit about the fees and the timeline. So the cost will be $150, the application fee, and that's not going to be due until must be received by March the 26th. There's going to be an annual fee once you're inducted to be a fellow of the Nurse Practitioners in Women's Health, and it's going to be billed every January, and it's going to be $250. The induction fee is $275. So once you are inducted, you will be expected to have a fee of $275. This does include your medallion and a lunch ceremony for the fellows, including up to one guest. Next slide. So for the timeline, this is going to open next week on February the 1st. The application portal will open February the 1st. You'll have about 6 weeks to go ahead and work on this. This includes your sponsor recommendations and your application. They will all be due by 11:59 p.m. Eastern Standard Time, March the 15th. Okay, and that's the FNPWH application portal. That's when it will close. So make sure everything's done well before that. March the 26th, the application fee will be due. So the application fee you can pay for it sooner, but it's going to be due by March the 26th, and that was the $150 fee. In late June, that's when the accepted fellows will be privately notified of their acceptance into the FNPWH program. So you will be notified sometime during late June. July is when the nurse practitioners in women's health will go ahead and announce who was accepted into the fellow program. And September 23rd and 25th, you will be expected to be at the induction ceremony at the NPWH Annual Women's Healthcare Conference in Richmond, Virginia. So we look forward to seeing everybody in Richmond. Next slide, and I believe it will be my next person speaking.
Thanks so much. I'm Dr. Shawana Moore. It's a pleasure to be among you all. And I'll be going through the frequently asked questions. However, if you have other questions that fall outside of the ones that are posed here, there will be an email that you can email those questions to directly. So the first question is, can my sponsor receive the recommendation form sooner in the process, or will they have to wait until I submit my application? So applicants, you do have for applicants, you will have access to your sponsor's recommendation form, and you should share that with your sponsor as soon as possible so that they can meet the deadline. It is your responsibility as an applicant to ensure that the recommendation is submitted by that deadline, which is March 15th at 11:59 p.m. Please ensure your recommender does submit that by March 15th so that you will not miss out on this amazing opportunity. Next slide, please. So next frequently asked questions. I'm a board certified nurse midwife or other board certified credential, and I practice in women's and gender related healthcare my entire career. Can I apply for admissions to the FNPWH program? So board certification as a WHMP is required for this application. The WHMP fellowship designation was created truly to recognize board certified women's health nurse practitioners and their specialized expertise in women's and gender-related health care. And again, this does align with NPWH's mission to grow the workforce of WHMP. So you have to be certified as a women's health nurse practitioner in order to apply for this fellowship. Next slide, please. So next question, I am a board certified women's health WHMP, but I'm retired. Can I apply for admissions to the FNPWH program? So yes, if you are a retired board certified women's health nurse practitioner, you are eligible to apply for admissions in the FNPWH program. You want to write about your extensive experience and your contribution that is aligned with the profession as well as NPWH's mission and vision. So you want to talk about all the accomplishments that you've had during your career and even during your retirement. And also really hone in on how you plan to continue to contribute to the commitment of the mission and vision of NPWH with your respective expertise. Next slide, please. So next question, will the rubric be shared with the applicant? So at this time, the rubric for the fellows program is not publicly available. And we try to ensure that we align with other practices of other national organizations when it comes to rubrics for various fellowship programs. Next slide, please. I'll turn it over to Katie or Julia to close us out.
All right, so we're going to begin our Q&A section of this part of the webinar. So I will read off the questions and our panelists will be more than welcome to answer. If you have any questions that were not answered throughout this webinar, please feel free to ask them via the Q&A box at the bottom of your screen. So to kick us off, our first question is from Iris Touré. Are fellows required to complete any mandatory obligations or duties, such as meetings/committees, during the time they are fellows?
I can handle that. As a fellow, you're always expected to remain engaged, so that there are other duties, obligations. Absolutely. You will always be expected to represent yourself as a FNPWH at all times, because you will be able to have people who contact you, ask you questions about the fellowship and about the organization. So obligation, yes, that is true. You are to represent this fellowship. You are a clinician. You represent the excellence of this organization. Committee service, that can wax and wane as it goes along, but there is service that is associated as well.
Thank you so much. Our next question has come from Kimberly Ward. What are the benefits of becoming a fellow?
I'm happy to take that question. So, like any other fellowship, it's a distinguished honor to hold a fellowship within a national organization. It shows that you have risen to the top of your profession and your expertise, and that you are sought after for your expertise. So again, it's an honor to be able to give that back to the profession. So then you have the opportunity to serve as a fellow and a mentor to other aspiring in early career or even mid-career WHMPs who are within the profession. I look at it as a way to give back to the community and the mission of the organization that you're aligned with, but it's also a point of honor and recognition for your great accomplishments and contribution as women's health nurse practitioners to the profession.
Thank you so much, Alana. Next question comes from Lori Endicott. How do you recommend finding sponsors?
I can speak somewhat to that too. If it's an environment where you are working along and somebody, and again, only one person needs to be a women's health nurse practitioner, so you may find other physician assistants, nurse practitioners, physicians, other people that have seen the value that you bring to the work that you're doing, and they can definitely be a sponsor. And if they're not currently a member, they may become a member of NPWH. It may not be with your current role. It might be somewhere that you've worked before, someone that has known you a long time as a women's health nurse practitioner. And so sometimes it is reaching, out of your normal day-to-day access of where you are currently employed. But I do encourage you to think about who has been somebody who has either been somebody who has seen you grow, helped you grow, or that you have been a leader for, and that you have been that role, and that gives an opportunity for them to speak about the role that they've played in your career. And they could be very early on or not. But I know it's a little bit awkward sometimes if you're not working, in maybe an academic environment, or you're not working in a clinic that's Planned Parenthood has a lot of women's health nurse practitioners. But think about there are people that you have affected and have also affected you, and sometimes that's a good person to ask to be your sponsor.
I want to add to that, Kristen. I agree with everything you said. I also think it's a great opportunity. You touched on this in your slides, to share the how wonderful our organization is with individuals that may not be members. And so I was in a similar position as Kristen, where one of my mentors and one of my sponsors was a member, and one wasn't, but very actively engaged within the women's health nurse practitioner community and became a member and then was able to sponsor me. So I think it's a good opportunity if you know somebody and they're not a member, to, because we are part of that public facing side of our organization. We represent our organization. This is a large part of becoming a fellow, that you're also able to communicate some of the benefits of being a member and why somebody that might sponsor you might also benefit from becoming a member as well.
Mm-hmm. And I would like to add as well, I actually got my previous instructor and I graduated 20 years ago. And thankfully she was a member. It wasn't a problem. And yes, being really active, like in my state organization, has brought me to know several other nurse practitioners in women's health. So I found it quite easy to find people who were nurse practitioners in women's health and nurse practitioners who actually have that area in women's health. So being active in other organizations really does help that out, but definitely looking even at your previous instructors as well. Thank you.
Thank you guys so much for all of that information. That's great. This is another question from Iris Teray. Are there a limited number of fellowship appointments? And I believe this would be assuming per cohort, not in total.
As a committee, we're not looking at the number of applicants we accept. It's really the quality and the breadth of what the applicant has done throughout their career as a WHMP.
Great. Some other questions, and if you have any other questions that we have not had the chance to answer, please feel free to drop them into the chat or via the Q&A box at the bottom of your screen. So next question comes from an anonymous person. What should you expect coming into the FNPWH program?
I'm not exactly clear about that question. Is it possible whoever submitted that question could elaborate?
I will leave some space for anyone who wants to elaborate. But in the meantime, we will hop on to the next question. Can FNPs in women's health apply? And this is from an anonymous attendee.
Well, I think what we've talked about is it's appropriate if you do women's health as an FNP, but what's required is a designation and board certification as a women's health nurse practitioner. So as an FNP, if you do have WHMP BC or board certified, you're welcome to apply. But you do need to you have to have that board certification in order to apply for this fellow opportunity.
Great. Thank you so much. And clarification on the previous question on what does it look like right after you get in? So like what can you expect during induction ceremony? What are the initial responsibilities you should expect right after induction?
Okay, this might be a little cheeky to work. It's a lot of work being a fellow whenever you get inducted to anything. I believe that our induction was recorded for this last ceremony since we were the inaugural group. It's a lovely ceremony. It is an opportunity for you to actually hear your accomplishments. Many times we do things and we don't realize we've done so much, and to receive that honor. It's also an opportunity for you to be the liaison, the front face, if you will, for NPWH during the conference, because a lot of the attendees will have questions for you Why did you decide to do this? What was the process? That type of thing. But also as a fellow, there is opportunity and collaboration between the fellows with the board and with the representatives in the regions for NPWH. So that is, if you want to call that a responsibility, I call it an opportunity that is available to fellows. Some of you have been also able to see the speaking that has happened where there's been the research presentation about various topics. Fellows are asked to participate with those types of things. So when I say work, there is work. It's fun though, but it is work, just as when you get a distinguished honor for other fellow opportunities, there is an expectation of remained engagement as well as demonstration of excellence.
Can I also just add that, like, because I think, to be very honest, we are their inaugural class. So this is a vague, like, established, we are working it out. And the exciting part is that if you become a fellow, you may be part of that development of what fellows do in NPWH and what we are, where we're going. So the baseline is, is this something, what have you done and accomplished? Where are your passions? Like all those things that you have done to be part of a group that shares passions in working in a variety of fields, but we are still working and building on it. And so there's some vagueness. There is no absolute obligation. When you sign on, you're committing 20 hours a week. So I think there is some like disconcern about like, what am I going to be asked to do? But there is also an open door now. So for somebody who hasn't been a huge part of NPWH except as a member and always, there for attendance, it is now an open door and access to more people, more information. And that in itself is a great collaboration, but it is not set in stone. So you are not signing up to give your blood for working 20 hours a week, but there is an expectation that you are going to continue to be somebody that will be representing the fellows and NPWH in a very broad manner. But there is no absolute defined thing that you are required to do except be there, be honored, be part of the fellow group, and then continue to work with this group to help develop it.
Yes, and I would like to add too, I mean, this is a very big recognition as far as what it is that you do. So more opportunities will be brought to you to serve on the committees. How we do a lot of educational summits, the sexual health summit, the menopause summit that's coming up as well. So yes, you'd have more opportunities to be involved with nurse practitioners in women's health, to serve in the committees. Obviously, this is also an opportunity for you to have more speaking engagements in our conferences and just to even advocate for the profession. We are pretty new and we're a small group. So yes, you would serve in a committee. Whereas if it was a much larger corporate, or a much larger organization, you might not need to serve in as many committees because it's so large. So for this organization, there's a lot more opportunities to be a part, to help grow the organization. So it's actually a really exciting time, because we all are getting to know each other and helping to just grow women's health. So hopefully you'll all get it. Mm-hmm.
The other thing I would just like to add, just to echo to what my colleagues were speaking about with the exposure and elevating their level of expertise, is even when it comes to advocacy and policy, I've had legislators on a federal level recognize my fellowship and call on me to come lend my time and expertise for congressional briefings. So again, it gets you out there not only for yourself, but for your profession, our profession as WHMPs, where policy leaders and legislative leaders will reach out to you and tap into you because you are a fellow of this national organization with this level of expertise, and they want your voice to be heard when it comes to advocating for various issues that are impacting the women's and gender-related populations.
Amazing. Thank you guys so much. And this is a question I actually have for you all, and I think it'd be lovely if we could go around and have everyone answer. What would you say to someone who's on the fence about applying? They're like, I'm 50-50. I could apply. I'm okay if I don't apply. What would you say to convince them to apply? What was that final push?
Why not? Honestly, like there's so much in life that I just think, we are nervous, we are hesitant to put yourself out there. But why not? If you have, this is something that you are passionate about, this is an area, there's a certain point in your life, you just want to say, why not? So I would say start the application. And put down things on paper and feel that out, but go for it.
And I would like to add to, I mean, this is a national recognition that from the outstanding contributions you have made to women's healthcare or education or policy. I think your patients, your fellow faculty need to be aware of your outstanding contributions you've done. And not only that, it provides a lot of leadership opportunities for you. But just like Dr. Moore was saying, this professional influence you have in areas, especially such as policy, especially during this time frame that we're seeing, women's health and gender health care really taking, a hit. I mean, we are going to be the leaders in helping to support this, especially being having that fellow behind your name. I mean, they understand you're that leader in this area, the contributions you've made. And so you're going to be a source of information for some of these policy influencers as well. So I would hope everybody would want to be a part of this organization because it's just brought so many opportunities to me just within the last several months, and I'm excited to be a part of it. Thank you.
This is Julia. This isn't a question. I just wanted to give some advice to any applicants. As someone who kind of saw all of this happen last year, one, pay very close attention to the requirements in the application. There are some specifics in regards to like CV length and things like that. And I have seen people disqualified just, their application's not reviewed because they didn't follow those directions. So please pay attention to all application directions. And then finally, in regards to the fee, the reason that there is a little bit of extra time to pay it is because you don't pay it during the application process. Within 1 to 2 business days after receiving your application, you'll receive an invoice to pay that. So if it's 11:55 on March 15th and you haven't paid your application fee, no worries. That's why we give that little bit of extra time. So it is a separate invoice process.
Great. Thank you so much for that clarification, Julia. So does anyone else have any other questions? Please feel free to drop them in the chat or in our Q&A box. I'm going to give you guys a minute or two to type. I know it can take a moment. But just to reiterate this, our application portals will be opening on February 1st, so very, very soon. And I am excited for everyone to apply. This is also a Cora webinar, so if you missed anything or just want to revisit something, just make sure you heard it right. Do not worry, it is recorded. You will be able to access it. And this is a question from Amy McKeever. I renewed my membership. However, my membership status is not current on the website. Who can assist me with this? So, Amy, I would recommend reaching out to info@npwh.org, emailing them, yes, and we can help sort you out there. Is there any other questions? If not, I'm going to let you all go. Thank you so much for tuning in. This is recorded once again, so please feel free to rewatch this recording while you are working through your application. And thank you to our panelists for joining us today and helping explain this whole process.
And if you have any questions throughout the process, we can't answer any specific application questions as far as your actual application. But if you have any questions about the process, please email fellows@npwh.org.
Thank you. Have a great rest of your day, everyone.